preserving jobs and protecting lives. A new report looks at the impact of COVID-19 budget measures on Singaporeans. Living with Omicron, we hear from an expert on how simpler rules will pave the way for Singapore to open up. And the first BTO launch for the year is underway, featuring housing projects in 4 estates. You're watching The Big Story. I'm Olivia Quay. You can subscribe to the Straits Times channel so you don't miss a single episode. 8 budgets delivered over the past 2 years have helped to cushion the impact of COVID-19 on the economy and significantly boosted Singapore's growth. In a new Finance Ministry report out today on the eve of the 2022 budget statement, it reveals the impact of fiscal and monetary support measures on the economy. Thanks to the measures, GDP grew by 7.6% last year. Without it, this would have been 6.8%. In 2020, the country saw a 4.1% fall in GDP, which would have been 10.7% otherwise. Key measures like the Job Support Scheme and Jobs Growth Incentive helped to save jobs as well. The unemployment rate hit 4.1% in 2020 and 3.5% last year. The ministry estimated that unemployment would have reached 6.1% in 2020 and 7.5% last year had there been no policy support. MOF's report also had estimates from the Health Ministry showing that Singapore's nationwide COVID-19 vaccine rollout prevented around 8,000 deaths during the peak of the Delta wave last year. Having one of the highest vaccination rates in the world also helped Singapore to keep the death rate low, at about 15.7 deaths per 100,000 population. That's on par with other countries with high vaccination rates like South Korea and Japan, and lower than other developed countries with lower vaccination rates like Germany and the US. Vaccines also helped avoid 33,000 severe cases and 112,000 hospitalizations. And in less than 24 hours' time, we will find out what measures will be in Budget 2022. Finance Minister Lawrence Wong will be delivering his statement in Parliament at 3:30 p.m. The Straits Times will bring you his speech live on our website, Facebook and YouTube channels. And after that, we'll have comments and analysis of what the budget means for you and your finances. 16,883 new COVID-19 cases reported yesterday. Aside from 194 imported infections, the rest were local. And of those, the vast majority, over 12,700, were detected through ART, which means the patients displayed mild or no symptoms. Almost 4,000 were detected through PCR tests. Joining me is Professor Teo Yik Ying, Dean of NUS's Swee Hock School of Public Health. Professor, more than 16,000 cases yesterday, over 19,000 the day before. Singapore has never seen such numbers until now. They look dire, but experts like yourself have said time and time again that we shouldn't focus on this top-line figure. So beyond that, what's your assessment of our current situation?
Thank you for having me. There are certainly many people around me who are and who have been infected with COVID-19 in the past 2 weeks. And I'm sure people, if they themselves are not infected, they will certainly know of others in their close social networks who have been infected or who have received health risk warnings. So yes, I think there are many people that are infected right now, and the number is certainly more than we hear from the daily official estimates, whether it's 16,000 or 19,000. Since I believe for every person that we report on the official count, I'm actually guessing there will be at least 1 to 2 other people who tested positive with the ARTs, but just simply did not come forward to see a doctor because perhaps they're mild and they think they are fine. So if we look at the situation in the healthcare settings, there is actually some pressure on the GPs and hospitals. For the GPs, well, they are, and perhaps rightfully so, the first line of defense when people with symptoms like cough, fever, sore throat, and these are the symptoms associated with Omicron infections. So when more people in the community are infected, they do go forward to the GPs for consultation and for treatment. And that's why we start to see a lot of crowding at GPs. But hopefully, these people are there not just to get an MC, because it's because they genuinely need to consult a doctor. Remember, now you really don't need an MC in this particular instance. Also, there is some pressure in the hospitals, especially beds in the isolation wards. Certainly, we are starting to see an increasing number of people who go to the hospital not because of COVID-19, but when they are there for their treatment of other conditions, the hospital will test these patients and realize that they actually have COVID as well. And therefore, if they are hospitalized, they need to be housed in isolation wards. So this has certainly increased the demand for bed spaces in the hospitals. But what is interesting is that this increase in demand, including for GP care, have not directly translated to a surge in ICU demand. So our ICU capacity is very well under control. What we are running out of are the isolation wards, but because we simply can't put someone with COVID in a general ward with other patients. So if we come back to your question around the current situation, Singapore is going through what, in my opinion, is a necessary process to go through to live with endemic COVID. I've always said that to live with endemic COVID for the long term, we will need a combination of vaccination, boosters, and also natural infections, because this is exactly what allows us as individuals to develop this long-term antibody response against COVID-19. So for a community as a country to be able to move on with COVID. So the numbers are actually not unexpected, as what Minister have said. And in fact, our public health modelers have already predicted such a scenario of 20,000 people infections will happen. We just need to continue monitoring the situation in the healthcare system to make sure healthcare services will not run the risk of being overwhelmed, as what we have been seeing in some of the other countries. At the moment, there is some pressure on the healthcare system, but we are nowhere near overwhelmed yet. That is a very positive sign for us.
Singapore is simplifying COVID-19 rules. There are 5 areas of focus: group sizes, mask wearing, workplace rules, safe distancing and capacity limits. And Minister Lawrence Wong said yesterday that these will enable authorities to adjust the SMMs more nimbly and responsively. Professor, can you explain how this can be done, as Mr. Wong says?
So yesterday's announcement actually adjusted some of these measures, but at the same time, we have kept the core measures, or what they call perimeters, such as mask wearing, such as workplace requirements, unchanged, 50% allowed to return. There were some relaxing, such as how we count group sizes now. For example, no longer limited to a per day basis of 5 visitors, but now it's on a per visit at any one point in time basis. So, and we have also increased the capacity limits for some settings, especially for sporting events. But actually, on my view is that on a day-to-day basis, there is actually no real material change to most people, especially now after the Chinese New Year period, where that's when people will make house visits to visit each other's household. Right now, it's past the Chinese New Year. Even if we relax this 5 people visitation limit on a per visit limit, it's not going to have a lot of impact. And I'm certainly glad to see some of the restrictions around park use, like barbecue pits, which is what I've always talked about, as well as some of the rather awkward requirements of safe distancing, whether it's in indoor settings or in toilets to be lifted, especially when you're masked, because it's always been debatable whether these requirements were really effective from a public health standpoint, especially when the highly transmissible variants like Delta and Omicron came about. So in terms of how these 5 perimeters really form the framework to adjust the safe management measures nimbly and responsively, my view is that it is more a consolidation of the measures that we have had all along in Singapore. But now we are framed in a manner that hopefully is easier to communicate, easier to understand, less confusing. So for example, we may decide to relax perimeters around group size, around workplace requirements, but if we keep the perimeter of mask wearing constant, it allows us to decide how to calibrate things. And when we think about nimbleness and agile responses, Singapore actually, we have been very quick to reinforce our measures whenever any threat re-emerges. So whether we frame it as this 5 parameters or not, I would say we've always been capable of quick responses, just that now we are communicating these measures in a different manner.
Well, Professor, earlier this month, in a piece by our colleague Salma Khalid, you suggested that group sizes could increase from the current 5, and this is already with the expectation that cases will go up. Are you surprised then that the task force made it clear just yesterday that now is not the time to ease rules?
Well, I'm not surprised on that front because I suppose Singapore, we have always been very cautious and conservative when it comes to relaxing restrictions, because I suspect our policymakers don't want a situation where by relaxing too quickly, if the situation turns bad again, especially if it means the hospitals are overwhelmed, then suddenly we see that we need to reinstate the measures or perhaps even introduce stricter measures. And if you contrast how Singapore has chosen to do this cautiously, if we compare against some of the bolder lifting of many measures that we see in a number of European countries and cities, certainly you will think of Singapore as very much risk averse. I do think, however, that we are not that far away from the point in time that we will start to increase group sizes for socializing, for dining in, even having a much broader lifting of our border control measures. I think it may just be a wait of another few weeks. But if you look at the fact that we now already allow different groups of 5 people to make home visits in a day, you can see that we are moving towards the posture of allowing much freer socializing, but perhaps just not yet. And I do expect these measures will be reviewed very, very closely. And when we talk about the 5 parameters, I actually don't see yesterday's announcement really to be about lifting measures, but instead I see it as an early heads up that Singapore will soon be ready to open up more broadly. It's coming soon, but just not immediately.
It's always a pleasure, Professor Teo Yik Ying there from the Swee Hock School of Public Health at NUS. In other news, more than 40,000 bus tickets under the land VTL between Singapore and Malaysia were sold yesterday and today after quotas were reinstated for trips starting from February 22nd. Singapore bus operator Transtar Travel has sold out its available tickets until March the 21st. There are also no more tickets for Malaysia's Causeway Link for trips between February 22nd and the 28th. About 3,900 BTO flats were launched for sale today, including 398 units in Kallang Whampoa, the second project under the prime location public housing model. In its first sales exercise of the year, the units are spread across 6 housing projects in 4 estates, with waiting times ranging from 3 to 5 years. National marathoner So Rae-yong says he won't appeal against his exclusion from the Singapore contingent at the Hanoi SEA Games in May and vowed to do some self-reflection to avoid future selection controversies. Although So is a 2-time SEA Games gold medalist, this is the second straight Games that he's been dropped, and is also despite comfortably meeting the qualification mark on both occasions. If you haven't planned out your weekend yet, we've got a few ideas for you. How about you check out a new hotel restaurant in the East that's been getting great reviews, or catch an Oscar-nominated film in the cinema? Or what about this? The latest streaming hit from South Korea, all about a zombie apocalypse. I can only be talking about All of Us Are Dead. It's not really my thing though, but maybe Jan Lee can convince me otherwise. So Jan, you've been binging on this one, haven't you?
Yes, I have, and I have to say it does seem like zombies and South Korea are a winning combination ever since Train to Busan, because we've gotten a lot of like zombie dramas, a lot of zombie entertainment. So, All of Us As Dead is just the latest entry lah. And I think what makes it really special, and I think what can possibly change your mind, is that it is not just a zombie apocalypse show. It is very much a zombie apocalypse show as well. Like there's some pretty gory, like fighting zombie stuff. The visuals are very good in that respect, and I really enjoyed that part of the zombie fighting. But what I think really makes it stand out is that it's also a coming of age story. So the fact that it's set in a high school, right? It really sets it apart from things like Train to Busan, or from things like Kingdom, or from like I think Alive was also a zombie apocalypse setting. So it really changes it, because it's like all these kids, right? And they're suddenly without, reliable adult supervision, and they bring in all that drama that comes with adolescence. So like crushes and like some very serious stuff like bullying, and insecurities about your looks, feeling like you don't know where you belong, and then having all these friends that it's like they bring in all that emotion from high school. So like you have your best friends, and then your best friend is getting attacked by a zombie. You have a crush on a boy, and then he's out there like kicking a zombie's head. So it's all of these things plus the zombie apocalypse, which I think makes it very interesting and very poignant.
Journalist Jan Lee there. Well, zombie's not really my thing, but perhaps this is more up my alley. A new Spanish film, Parallel Mothers, out in cinemas today. Let's bring in a film correspondent, John Lui. So, John, is this another Oscar-winning performance from Penelope Cruz?
Yeah, she was nominated for an Oscar for Best Actress for this performance. She's always been one of the better actresses out there, but I think she really shines in this one. Now, Spanish filmmaker Pedro Almodovar, he specializes in movies, and he's worked with Cruz a lot. In movies about women, in this film, he celebrates women as a force of life. They create hope and optimism for the future. The only men here are sperm donors. They are dads who for some reason cannot be in the picture. They're either dead, or the women don't consider them good enough to be in the picture. So at heart, you have two women. One represents youth and the future, and the other represents maturity and the past, the history of Spain. That one is Janice, and she's played by Cruz. So she's a photographer, and for some reason or another, she gets pregnant, and so does Anna, played by Melina Smith, and the two of them give wonderful performances as women who represent opposing forces of womanhood in Spain.
John Lui, film correspondent. Now let's talk about that new hotel in the east, the Dusit Thani Laguna Singapore, and what its kitchens have to offer. Here's a senior food correspondent, Wong Ah Yoke. So, Ah Yoke, what's the menu like over there?
Okay, yeah, the restaurant is called Greenhouse. It's a multi-cuisine restaurant. So they have 5 kitchens, which are scattered throughout the restaurant, all open kitchens. And each kitchen does a different kind of cuisine. So you can get Japanese food, Italian food, Indian food, Chinese food, and of course Thai food, because Dusit Thani is a Thai chain hotel. Yeah, so you can get like let's say a pizza, or you can get yakiniku, or you can get a tandoori. But my favorite cuisines over there are Thai, of course, because they brought in a Thai chef from Bangkok, so it's really authentic. I love the tom yam goong. Comes with like really big river prawns, and they plate it so beautifully. And there's also like green curries, and there's pad thai if you like pad thai. And besides Thai food, I also really like the Chinese kitchen. They do sweet and sour pork, which on the menu they call kurobuta pork, because they use this premium pork, right? And it's really good because kurobuta pork has very good flavor. And when you bite into it, they have a coat that's a little bit crispy, but inside the meat is so juicy and flavorful. So that's also one dish you should try over there. And the Chinese kitchen also does a dish called ansin chicken, which is a chicken smoked with tea leaves. Really, really very fragrant, very beautifully done. And besides food, another reason to check out this restaurant is it's so beautiful because it has a forest theme. And the restaurant is filled with plants. So they have like plants on the wall, plants on the side, plants everywhere. So yeah, it's really, really lovely ambience. To me, it's really the most beautiful restaurant you can find in the east of Singapore. And the Dusit Thani is actually next to the Laguna Golf Club. So from the restaurant, when you look out, you see the golf course. So it's all greenery outside as well. So it's like, oh, really green everywhere. Oh, wonderful for relaxing, wonderful for your eyes, and good food too.
Thank you to senior food correspondent Wong Ah Yoke. And that's the big story for today. I'm Olivia Quay, but before we go, here's one more item for your diary. Buskers Arts Academy marking 70 years of dancing with a special lineup of events next weekend. It will kick off with a musical performance, Sangeeta Saptati, on February 25th and 26th, featuring original compositions by musicians from the Academy. Tickets are available at the Buskers Arts Academy website.